Hey guys, welcome to Mystery Diagnosis.
But then, one day, everything changes.
I was at work. I had just eaten about an hour before and sat down. And all of a sudden I felt sick to my stomach and started vomiting, and I just couldn't stop. And I drove about a 45-minute drive back to my house and made it just in time, and still continued to vomit at home.
By the time Danielle finally gets to sleep that night, she's vomited over 20 times.
That's horrible.
And when I kept vomiting and vomiting, it turned to like this greenish color, and it was
I wonder if
foamy.
that's bile.
Her stomach was hurting,
I'm trying to imagine
and she
why
just
that's
didn't look good. She
sarcasm.
almost looked gray, almost.
I called my family doctor, and they got me an appointment right away. My doctor told me that it was just a stomach bug. She gave me some anti-nausea medicine and told me that if I didn't stop vomiting, that to go to the emergency room.
Just couldn't stop, and there was nothing that she was really throwing up, just the bile and just
That's right,
feeling
it was
very
bile to be
nauseous. So we went to the hospital, and that's when things started happening.
I wonder if she has a bile duct problem.
In the ER, Danielle's uncontrollable vomiting continues. When blood tests show that she is severely dehydrated and her electrolytes are out of whack, she's immediately given anti-vomiting drugs and admitted for testing.
That doesn't surprise me that she's dehydrated and electrolytes are low.
The tests all came back negative. And blood work was normal except for the fact that I was dehydrated.
The medication works well enough that Danielle stops vomiting, and doctors are able to take her medical history. When she tells them that gallstones run in her family, suddenly everything makes sense. Gallstones are hardened, rock-like pieces of bile that collect in the gallbladder and can cause the pain and vomiting that Danielle is experiencing. But surprisingly, scans of her gallbladder and stomach come back normal.
They ruled that out as a possibility.
Now, after 3 straight weeks, the vomiting has wreaked havoc on Danielle's body.
After all the vomiting and all the force, my stomach was just sore, and I was getting really weak and losing a lot of weight.
She would just come home and lay on the couch, and basically at that point, it was just like, okay, I'm just waiting till I go back again to the emergency room.
After weeks with no answers in sight, Danielle is finally referred to a gastroenterologist.
Good.
The gastroenterologist wants to get a clear look at Danielle's digestive tract, so he decides to perform a colonoscopy. But once again, the tests come back with normal results. It is then that Danielle's GP decides to take a radically different approach.
My primary care physician referred me to the surgeon because she thought it still could be my gallbladder.
Surgery is a drastic step, but at this point, Danielle is willing to try anything.
I was kind of happy. Normally I would be very scared, but after being sick for so long, I just wanted someone to find out what was wrong. I had lost about 30 pounds at this point. My eyes had turned red. The insides of my eyes had turned red.
Her vomiting was so violent that the vessels in her eyes would break.
It's supposed to be a minimum of 30%, and mine was only 16% functioning.
Danielle is diagnosed with cholecystitis, or inflammation of the gallbladder, normally caused by a gallstone stuck in the neck of the gallbladder. Within 30 minutes, Danielle is prepped and ready for surgery to remove her gallbladder.
I was really nervous about having the surgery, but at the same time, I was very excited to think that this might be the answer as to why I've been so sick.
And for the first time in weeks, doesn't feel like throwing up.
After the surgery, I was able to eat, I was able to drink, I had no nausea whatsoever, a little bit of pain from the surgery.
But then the inconceivable happens. Danielle starts vomiting again.
But the pain I was having had moved down to my right side and lower, and he thought that maybe it could be my appendix.
I don't
Danielle
think
is
so.
prepped for an emergency appendectomy.
This time with the surgery, I wasn't as worried. I just was more fed up than anything. Just do whatever you have to do
I don't
to figure
know.
out what is wrong with me. The surgery went really well. They removed my appendix, and when they did the exploratory surgery, they really didn't find anything wrong. The gastroenterologist decided to put in a PICC line to help feed me through it. This way I was getting nourished at the same time when I couldn't keep anything down.
Dr. Jamadar is shocked when he registers the pressure at the sphincter of Oddi, a small circular muscle located at the junction of the bile and pancreatic ducts.
The normal basal sphincter of Oddi pressure is a pressure of under 40 millimeters or less of mercury. Danielle's was significantly elevated at 70 millimeters of mercury.
It's sphincter of oddi dysfunction.
She had a sphincter of Oddi dysfunction.
The sphincter of Oddi is a one-way valve regulating the flow of fluids from the bile and pancreatic ducts into the bowels. Sphincter of Oddi dysfunction happens when the muscle becomes too tight and the ducts can't drain properly. The ensuing buildup of bile and pancreatic fluid causes tremendous pain. Luckily for Danielle, sphincter of Oddi dysfunction can be cured right away through a procedure called a sphincterotomy.
Another catheter is inserted into the bile and or pancreatic ducts, and this catheter has a little wire attached to it. It's in the shape of a bow, and electric current is applied to this wire, and the sphincter is cut. It's just a 1 centimeter cut that's done internally.
Dr. Jamadar makes the cut, relieving the pressure caused by the tightly wound sphincter of Oddi, which finally allows the pancreatic and bile ducts to drain. Within a few hours, Danielle is awake and feeling better than she has in months.
The next morning, I woke up and I told her, I don't feel nauseous anymore, Mom. And she just started crying, and I did too.
She looked better. She sounded better.
Now, just a year later, Danielle's life is back on track.
Thank you for watching. Make sure you like, comment, and subscribe. Hit the notification bell to know when I post a video. I'll see you next time.